Welcome to the Natural Remedies Seminar. In our Natural Remedies Seminar, we're going to be looking at poultices and compresses. And the first one we're going to look at is castor oil compresses. It's not a poultice, it's a compress. Castor oil penetrates deeper than any other oil. And wherever it penetrates, it can break up lumps, bumps, adhesions. So great for cysts in the breast, for breast cancer, great for irritable bowel, great for constipation. It's very good at breaking up stones in the gallbladder, kidney stones, bone spurs. If the bone spur has been there 3 years, it might take 3 months. If the bone spur's been there 3 months, it might take 3 weeks. Little by little, the body heals, so be patient.
Dr. Barbara O'Neill, an Australian naturopath and health educator, has become a polarizing figure in the discourse surrounding health and wellness. Known for her advocacy of natural remedies and holistic health practices, O'Neill has often claimed that Big Pharma is intent on keeping public unaware of how to heal themselves. This assertion taps into a broader narrative that suggests pharmaceutical companies prioritize profits over genuine health solutions, leading to a distrust of conventional medicines. While her views have garnered a significant following, they have also attracted criticism and scrutiny, particularly regarding the safety and efficacy of her recommendations. At the heart of O'Neill's philosophy is the belief that the human body possesses an innate ability to heal itself, provided it is given the right conditions. This perspective is not unique to her. Many alternative health practitioners espouse similar views, emphasizing the importance of diet, lifestyle, and natural remedy. O'Neill's works, such as Self-Heal by Design and Health and Healing Secrets Revealed, advocate for a lifestyle that aligns with the body's natural healing processes. She argues that many health issues stem from poor dietary choices, environmental toxins, and lifestyle factors that can be addressed through natural means.
So I'm going to make a compress. It's like a little pack. The thicker the pack, the more castor oil it can hold, and the more castor oil can go into you. Now what I've done is I've cut up an incontinence pad, I've cut it up, and I've opened it up, and I've put a few layers of cloth in there to make it thicker. And what I'm going to do is put masking tape on the edge. So the beauty of this is the plastic isn't really touching you. So the only thing that's touching you is the paper topping, and it's got that cloth insert, and the plastic's on the back. And the plastic is really just to protect your clothes and stop oil going everywhere, which you don't want. So I'm just going to seal those edges. And then I'm going to put the castor oil on. Now the reason why I'm doing this first, so there we have our little pack. Now to secure that, I just staple the edges. I used to stitch it with a little cotton and thread, and my staff came up with this great idea of stapling it, and it takes about a 1/16 of the time, and it holds it quite nicely. And I'm doing it now because it's going to take a little while to soak in. And what I do is I basically do the middle third, because as it soaks in, it'll spread out a little bit further. I can't hold that up now, but probably in about 15 minutes I will be able to hold it up. You see, it's such a thick oil, it just sits on top. So you've got to give it time to soak through. I haven't covered it because then there's no leeway for the excess oil to go. And also when it goes on your hot body, the oil will thin and spread out a little bit more. So you want to give a little bit of room for spreading. This compress can be used maybe every day for a month, and then you might make another one, because it's not drawing anything out of you. It's just a vehicle to hold the oil so it can go into you. And this size I've made here, that's a great size for chest, for congested chest. That's a great size for abdomen. And that could be cysts on the ovaries, it could be fibroids in the uterus, it could be constipation, it could be irritable bowel. So that's a nice size for those areas. How long would it take? Well, it depends how big it is, and it depends how long it has been there. Consistency is the key.
However, O'Neill claims often intersect with conspiracy theories about the pharmaceutical industry. Proponents of these theories argue that pharmaceutical companies deliberately suppress information about natural healing methods and effective treatments in favor of promoting drugs that generate higher profits. The narrative suggests that a vast conspiracy exists wherein the medical establishment prioritizes profit over patient health, leading to a lack of transparency in the healthcare system. Critics of this viewpoint argue that while there are legitimate concerns about the pharmaceutical industry, such as the marketing of unnecessary medications and the withholding of negative research, these issues do not equate to a coordinated effort to suppress effective treatments. O'Neill's controversial stance had led her to being banned from practicing it in Australia due to the allegations of providing dangerous health advice. The Healthcare Complaints Commission found that she had made unsubstantiated claims about curing cancer and discouraged patients from seeking conventional treatments like chemotherapy. This ban has fueled her narrative of being persecuted by a system that favors pharmaceutical solutions over natural remedies. Supporters argue that her approach empowers individuals to take control of their health and explore alternatives to conventional medicine.
And what I'm going to do now might surprise you. I'm going to put the onion on the bottom of the feet. So why do we put the onion on the bottom of the feet? We put the onion on the bottom of the feet because the bottom of the feet, or the feet I should say, are a reflex for the chest. And we're going to put the onion on the bottom of the feet for if someone has a bad cough in the night. And I'm going to use a plastic bag. Now at Misty Mountain we buy boxes of starch bags, so they're made out of starch, and that would be the best. Now if you don't have starch bags, you can certainly use a cloth. So you might use a cloth, put the onion like that and put it in the bag, and then what you do is you put your foot on the onion like that, and then you twist it around and put a sock on. So the bottom of the feet is touching the onion, and then you put a sock on and it holds it in place. Now my grandson, he was 3 at the time, I was visiting my daughter and he had a bad cough, and she gave him a hot bath, which always eases the cough, and put him to bed, and he was coughing and coughing and coughing and coughing. And we thought he'll be asleep in a minute, but he kept coughing and coughing. So after half an hour I said to Em, let's do the onion. So we got him up, we chopped up an onion and put half the onion chopped up on one foot and half on the other foot and put him to bed. Not one more cough. It's almost unbelievable. You almost have to do it to believe how incredible it is. Not one more cough for the whole night with the onion on the bottom of his feet. So that's great for a night cough.
The skepticism surrounding Big Pharma is not unfounded. Many people feel disillusioned by the pharmaceutical industry's practices, which can include aggressive marketing tactics and the prioritization of profit margins, as well as the potential conflicts of interest in research. High-profile cases of drug recalls and scandals have further eroded public trust. Critics of the industry highlight the need for greater transparency and accountability, asserting that the public deserves to know the full range of treatment options available, including natural remedies. O'Neill's advocacy for natural healing aligns with a growth movement that seeks to challenge the status quo of conventional medicine. This movement emphasizes the importance of lifestyle changes, such as adopting a whole foods diet, engaging in regular physical activity, and utilizing herbal supplements. Proponents argue that these changes can lead to significant improvement in health and well-being, often without the side effects associated with pharmaceutical drugs. O'Neill's teachings resonate with individuals seeking alternatives to the medical establishment, particularly those who have experienced dissatisfaction with conventional treatments.
Now we're going to have a look at cayenne pepper. Cayenne pepper, we've got cayenne pepper in this little container here. Cayenne pepper is a remarkable herb. Some people say we shouldn't use it because it's a stimulant. It is not a stimulant like caffeine or alcohol or marijuana is a stimulant. It's a blood stimulant. That means it's good because Leviticus 17:11 states that the life of the flesh is in the blood. So anything that moves blood is going to be helpful. There's a book you can get. It's by Sam Beiser. It's called Curing with Cayenne. And he shows in that book that you put cayenne with any other herb and it'll intensify that other herb's action. It's a blood stimulant. It can be used internally and it can be used externally. And I think in your book it shows how it does three main things internally in the blood. It thins the blood, it strengthens the arterial walls, and it opens the capillaries. So let me tell you about an experience I had a few years ago. It was one of our retreats. I got the call, lady'd had a heart attack. I was only 3 minutes away, that's why you have to be fit. I ran down, it was a cooking class with about 16 people, and she was lying on the floor. She was 80. Her husband said she'd already had a few that year, and they always called the ambulance, but they thought, let's see what they do. And I said to my offsider, cayenne pepper, quickly. We got the cayenne pepper. Now there was a guy holding a pulse, and he said the pulse is almost gone. She was just white. So I don't know how much I got, you're just in a hurry, so I think I got about half a teaspoon, put it straight in her mouth. She was half conscious, gave her a little bit of water to drink. And the guy holding the pulse yelled out, the pulse is strong. This would have been 2 minutes. And you could feel that pulse come back, and all the blood came back to her face. She sat up and said, what happened? Everyone around was going, whoa. And I said, no, it's not me, it's the cayenne pepper. So we sold out of cayenne pepper that program. What did the cayenne pepper do? It thinned the blood, it opened the capillaries and got a dramatic delivery of blood through the whole body. Remember, 1 minute for 1 drop of blood to go around your whole body. I have read about it, but then I actually experienced it. So cayenne pepper can also be used to boost hydrochloric acid. You take it in internally, it'll boost digestion. Cayenne pepper can also ease a sore throat. Remember, it's in the flu bomb. It might give it initial tingle, but then when that tingle settles down, it eases it. Some people take or are told to take aspirin for a blood thinner. In fact, I have read where it is recommended that anyone over the age of 50 should be on half an aspirin a day. You might have heard that. Well, what the research is showing today is that aspirin causes stomach bleeds. It's the #1 cause of stomach ulcers. It causes brain bleeds and eye bleeds. That's what the recent research is showing. Cayenne pepper will not cause that at all. But if cayenne pepper's in your blood and it sees a bleed, it'll constrict the blood vessels to stop the bleeding. Yes, it dilates the blood vessels when it's in the blood, but if it sees a break, it'll constrict that. Beautiful illustration of Psalm 104 verse 14, that God gave herbs for the service of man. Remember? They're there to serve you. Where would you like me? What would you like me to do? Thin that, seal that. That's the cayenne pepper. In fact, it's just about a first aid kit in one. Is the cayenne pepper, and you'll get used to it.
Critics of O'Neill's approach, however, caution against the potential dangers of relying solely on natural remedies. While lifestyle changes can undoubtedly support health, they may not be sufficient enough to address serious medical conditions. The risk lies in individuals avoiding necessary medical treatments in favor of unproven natural therapies, which can lead to dire consequences. For instance, O'Neill's claims regarding cancer treatment have raised alarm bells, particularly when patients forego evidence-based therapies in favor of unverified methods. The conversation surrounding O'Neill and her views on Big Pharma reflect a broader societal struggle with trust in the healthcare system. Many individuals feel caught between the desire for natural solutions and the need for reliable medical care. This tension is exacerbated by the proliferation of information available online, where anecdotal evidence often overshadows scientific research. The rise of social media has allowed alternative health advocates to reach wider audiences, further complicating the landscape of health information. In navigating this complex terrain, it is essential for individuals to approach health decisions critically. While O'Neill's emphasis on self-healing and natural remedies can be empowering, it is crucial to balance this perspective with an understanding of the importance of evidence-based medicine, engaging with healthcare professionals, seeking second opinions, and being informed about treatment options can help individuals make choices that prioritize their health and safety. Ultimately, the debate surrounding Dr. Barbara O'Neill and her views on Big Pharma serves as a microcosm of the larger conversation about health, wellness, and the role of the pharmaceutical industry. As society continues to grapple with these issues, it is vital to foster an environment where open dialogue can occur, allowing individuals to explore various perspectives while prioritizing their health and well-being. The quest for knowledge and understanding in the realm of health should not be stifled by fear or misinformation, but rather guided by a commitment to evidence and compassion. Thanks for watching. If you enjoyed this video, be sure to smash that like button and subscribe for more exciting content.